A lot of pain that gets labeled low back pain isn't coming from the spine at all. It's coming from a joint most people have never heard of, one that sits where your spine meets your pelvis. Welcome to the educational channel of Dr. Ryan Kuda, a board-certified interventional pain physician serving the Chicago area. On this channel, we break down the procedures and the research that shape how pain medicine is actually practiced. Today, the sacroiliac joint injection. The sacroiliac joints, the SI joints, are a recognized but frequently overlooked source of low back and buttock pain. The pain can mimic a disc problem or sciatica, which is exactly why it gets missed. When the SI joint is the real culprit, an injection can play two roles at once, helping confirm the diagnosis and providing relief. You have two sacroiliac joints, one on each side, connecting the triangular bone at the base of your spine, the sacrum, to the pelvis. They don't move much, but when they become inflamed or irritated, they can produce stubborn pain in the lower back, the buttock, and sometimes the hip or groin. A sacroiliac joint injection delivers medication, typically a local anesthetic, often combined with an anti-inflammatory steroid, into or around the joint, using imaging for accuracy. The anesthetic provides the diagnostic information. If numbing the joint relieves your pain, that points to the SI joint as the source. The steroid is aimed at calming inflammation for longer-term relief. This is typically considered when the pattern of pain, the physical exam, and provocative tests all point toward the SI joint, and when conservative care like physical therapy hasn't been enough. It's especially worth investigating when back pain sits low and to one side, over the buttock, rather than centered in the spine. Who is it less likely to help? People whose pain is genuinely coming from a disc, a nerve root, or the facet joints, which is why pinpointing the source matters before injecting. And like the other procedures we cover, an injection manages pain and inflammation. It doesn't correct the structural instability of the joint on its own. Here's the evidence picture. Image-guided injections are well established as a way to confirm that the sacroiliac joint is a pain source. When carefully done, a clear response to numbing the joint is meaningful diagnostic information. On the therapeutic side, the evidence for lasting relief from steroid injections is more variable. Some patients get substantial, durable improvement, others get shorter relief, and response differs depending on the underlying cause. So the honest framing is, it's a valuable diagnostic step and a worthwhile therapeutic try, but not a guaranteed long-term fix. That diagnostic value is also what opens the next door. When injections confirm the SI joint as the source, but the relief doesn't last, that finding can point toward a longer-lasting option, radiofrequency ablation of the lateral branch nerves that supply the joint, similar in concept to facet ablation in the spine. The injection, in other words, is often the first rung on a ladder rather than the whole staircase. The procedure is outpatient and usually brief. You lie face down, the skin over the joint is numbed, and the physician uses live X-ray guidance, fluoroscopy, to place the needle accurately into or alongside the joint. Accurate placement is the whole game here. Because the joint is deep and irregular, image guidance is what separates a reliable injection from a guess. The medication is injected, the needle comes out, and you're typically up and moving shortly after. The anesthetic often produces noticeable relief within the first hours, useful diagnostic information, while any benefit from the steroid tends to develop over the following days. Many physicians will ask you to track your pain over the hours and days afterward, because that record is what distinguishes the short-term anesthetic effect from the longer steroid effect, and informs what to do next. Recovery is generally easy. Some soreness at the injection site is common for a day or two, and most people return to normal activity quickly. As with any injection, there are risks, and which ones matter depends on your anatomy and your health. A discussion to have with a physician who has examined you. When the diagnosis is right, the appeal of the SI joint injection is that it does double duty. It helps prove where the pain is coming from and can deliver real relief at the same time. And it sets up smarter decisions if the pain comes back. Bottom line, the sacroiliac joint is an under-recognized source of low back and buttock pain, and an image-guided injection can both confirm it and treat it. The relief may be lasting, or it may be a stepping stone toward a longer-term option. If this sounds like your pain, a useful question is, could my back pain actually be coming from the SI joint? And how would we test that? A reminder before we wrap. This is educational content, not medical advice. Talk to your own doctor about your specific situation. If this was helpful, subscribe. We walk through pain procedures the same way every time. What they are, who they help, and what the evidence actually shows.